Ah, okay, thank you.
Bisa dimulai Bu Dewi atau saya perlu cek dulu yang dari Taiwan, apakah sudah siap? Hai Krista, everything set already? Krista, you are still mute. Everything set already? Hello, is everything set already, or we still need for a moment to give you a time for setup? Is okay? So is everything is okay? We can start the activity. Is that fine? Okay. Mungkin Bu Dewi bisa dimulai.
Recording in progress.
Okay, Mr. Arik, we will start now. Okay. Okay, my attention, please. The agenda will be start now. Ladies and gentlemen, good morning. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam
Waalaikumsalam warahmatullahi
wabarakatuh.
wabarakatuh.
A very warm greetings to each and every one of you. Welcome to International Visiting Professor Applying Modern Biology for TCM in the Scientific Research, organized by collaboration between Nursing Study Program, Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang, and Taiwan International Healthcare Training Center. I am Dewi Setewati, the MC for this event. On behalf of the organizing committee, we extend our appreciation for your presence today. The Honorable, the Dean of Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang, the Head of Nursing Study Program, Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang, the Director of Taiwan International Healthcare Training Center, the Honorable Distinguished Speaker, Professor Chi-Feng Liu, PhD, the Honorable nursing lecturers, nursing students, and all of the participants. The Honorable distinguished guests, ladies and gentlemen, let us all rise for the listening of the Indonesian National Anthem, Indonesia Raya, and continued by Mars Muhammadiyah. Ladies and gentlemen, let us listen to the recitation of prayer, which will be delivered by Nurse Muhammad Nur Harisna Al Jihad, Magister Keperawatan Spesialis Komunitas. Please welcome.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
A'udzu
wabarakatuh.
billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Hamdan syakirin, hamdan na'imin, hamdan yu'afi ni'amahu wa yukafi'u mazida. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karim wa 'azimi sultanik. Ya Allah, ya Tuhan kami, segala puji atas karunia dan kenikmatan yang Engkau berikan kepada kami. Hari ini kami berkumpul dalam kegiatan UNIMUS International Visiting Professor Series yang diadakan oleh Program Studi Profesi Nurse tahap akademik Fakultas Ilmu Keperawatan dan Kesehatan Universitas Muhammadiyah Semarang. Berikanlah kelancaran, keberkahan, serta penuhilah pertemuan ini dengan kebaikan dari awal hingga akhir nanti, ya Allah. Ya Allah yang Maha Kaya, bimbinglah kami dengan hidayah-Mu. Jadikanlah ilmu yang Engkau berikan kepada kami ilmu yang bermanfaat untuk umat dan bangsa. Jauhkanlah kami dari segala mara bahaya dan penyakit hati. Hiasilah hati kami dengan rasa syukur dan cinta kasih. Ya Allah, kami sadar bahwa kami ini hanyalah manusia biasa, penuh dengan khilaf dan salah. Maafkanlah segala dosa kami, orang tua kami, guru-guru kami, serta para pejuang yang gugur di jalan-Mu. Rabbana atina fid dunya hasanah, wa fil akhirati hasanah, wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun, wa salamun alal mursalin, walhamdulillahi rabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
Welcoming speech by Vice Dean of Faculty of Nursing and Health Sciences, Universitas Muhammadiyah Semarang, Dr. Muhammad Fatkul Mubin, Magister Keperawatan Spesialis Keperawatan Jiwa. Please welcome.
Bismillahirrahmanirrahim. The honorable speakers in this visiting professor from NTUNAS, Taiwan, Professor Wen Ai Liu, RN PhD, and Professor Chi-Feng Liu, PhD, Xie Liu Ji Yu Jieshu, De Cici. Thank you for taking the time to share your experience with us. Let me convey my best regards to you, participants, and committee who have facilitated the current moment, especially head of the UNIMUS Nursing Study Program. This condition is very possible because many experts and ancestors are serious about traditional medicine, such as Mr. Sanu. In Indonesia, there are many natural resources that can be used as medicine. Currently, there are many institutions that have developed traditional medicine made from natural ingredients. but the existing institutions are not comparable to the existing natural materials. Now is the right time to deepen the knowledge of traditional medicine with two experts in their field. Faculty of Nursing and Health committed to leading research and publication. More publication will not only benefit the lecturers themselves, but will
Gabusnya dapat
also benefit
berapa?
the institution. I hope
Ini
that
kemauan.
nursing study program will continue to develop and be more creative in scientific activities in the future. Take advantage of existing interinstitutional cooperation, both in the field of research, international seminars, curriculum development, as well as lecture and student exchange and other activities. I also hope that this activity will be useful for the participant and that there will be follow-up activity. Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Mubin. Next, introduction of Taiwan International Healthcare Training Center to the IHTC team. Would you please?
Hello, can you hear me? Taiwan International Healthcare Training Center, TIHTC, is co-hosting today's event with the University of Muhammadiyah Semarang. In the past 20 years, over 2,000 healthcare professionals from 74 countries have received training through us, including doctors, nurses, healthcare administrators, health officers, and so forth. Let's see what's so special about us.
没有，我听得到。我看那边是有声音。没有声音，听不到影片声音。嗯。
Sorry, Eric.
Mm.
Try to fix it, but we don't
Cannot.
think we can play the video now, so we can start the professor's sharing now.
So
Sorry about this.
yeah, it's okay. It's okay. Maybe so we need to continue to another session. So or later you will share to us the video or just share us the link so everyone can see the introduction of the ISTC. It's okay.
Okay, thank you for TIHTC team. Okay, we will continue the next agenda. Ladies and gentlemen, we come to our main session. Is a presentation from the speaker. Presentation and discussion will be conducted by Nurse Nuri Sukraini as a moderator. Mrs. Nuri is an alumnus of Prince of Songkla University of Thailand. Okay, Mrs. Nuri, are you ready? Okay, would you please?
Thank you, Miss Devi. Yeah. Okay. Assalamualaikum warahmatullahi wabarakatuh. Yeah, to all of the participants who have already come to this room because the agenda today is offline and also online. So also to all of the participants in the Zoom meeting. Thank you very much for the time. Before we start, Mr. Arik, I would like to ask, is Professor Chi-Feng Liu already joined with us? Okay.
Yes, he's ready.
Okay. Okay, thank you. Yeah. Before we start, I would like to introduce for our speaker for today, Professor Chi-Feng Liu. Yeah. Thank you very much for Professor Chi-Feng Liu that today can have an opportunity to join with the nursing program Universitas Muhammadiyah Semarang in the agenda of visiting professor series. Yeah, today is the third series. And then for the topic today is applying modern biology for traditional Chinese medicine in the scientific research, the scientific research, aplikasi terapi komplementer dalam penelitian ilmiah in bahasa Indonesia, so that we can know that today there is a tendency that people who change from the conventional medicine to the complementary and alternative medicine because they have some likeness of the conventional medicine. So the speaker for today is very expert to that exam for Professor Chi-Feng Liu. I'm so sorry. I can. Yeah. And I would like to introduce for the CV of Professor Chi-Feng Liu. Please, Mr. Arik. Yeah. Professor Chi-Feng Liu, currently is associate professor in the NTU NHS, and he have an education in the PhD program in Taipei Medical University, Institute of Medical Science Taipei, Taiwan in 2003, and also in the China Academic of China's Medical Science, medical doctor in science in China. So the major subject is Chinese medicine. So he is very expert for this topic for today. And also Professor Chi-Feng Liu have a lot of the publication publication about the complementary alternative therapy because his specialty research about first about traditional Chinese medicine, and second about evidence-based complementary and alternative medicine, and also about pharmacy. There are a lot of journal from Professor Chi-Feng Liu, from the efficacy of transcutaneous in the post in the elderly and also in the last. There is a many. If I would like to write one by one, the last Professor Chi have the effect of transcutaneous electrical nerve stimulation through occupation of Buchan and Shenmai on intraocular pressure in patients with glaucoma. So there are many research that have conducted by Professor Chi-Feng Liu, using applying the modern biology in the Chinese traditional medicine. I think all about the Professor Chi-Feng Liu. Hello, good morning, Professor Chi-Feng Liu.
声音哦，好，真的可以哦，开始了吗？开始了啊、好。Yes. Hello, everyone. Good morning. And behind my back is our track Chinese medicine. You can see the medicine track. Okay. My major is Chinese medicine, and the Chinese medicine like alternative medicine. As I am speaker Chi-Feng Liu, now I'm sharing with you a topic applying modern biology for traditional Chinese medicine, in brief TCM, in a scientific research. Because I am served in the nursing department in the NTU NHS, so I teach many master PhD students for nursing alternative medicines research. Applying modern biology technique is a non-invasive method. Because our nursing department, we just only can use non-invasive method to do our research. So next, first I introduction the role of TCM in modern medicine. Our medicine in the world, including among three types. The one is Western medicine. Two is traditional Chinese medicine. Third is naturopathic medicine. As we know, traditional Chinese medicine, TCM, has been considered as an alternative medical system in Western medicine. But in our Chinese group, we see TCM is a mainstream medicine. And the next, more scientific and clinical evidence are needed to integrate the TCM into the mainstream of medical care, like COVID-19. But our basic series in TCM, there are three series. One is yin and yang theory. In Chinese medicine, we call it yin deficiency. In Chinese, we call it yin xu. The Chinese yin xu in English is yin deficiency. Yin deficiency, their symptom is like a sympathetic nerve active. If you in deficiency, you maybe have the syndrome of increased heart rate, increased blood pressure, and increased blood glucose, something like this. And yang deficiency, like you feel your hands, your foot are very cool, like something this one. So yin deficiency is something similar to the sympathetic nervous activation. Yang deficiency is something like a parasympathetic nervous activation. So we integrate Chinese traditional Chinese medicine combined with Western medicine. The basic series in TCN2 is we call it is 5 elements series. The 5 element series, we also can do something research. But today, we focus on the meridian and the acupoint theory. The next, we show studies based on the meridians and the acupoint theory. The first, acupuncture is an integral component of TCM that includes both needle. Needle is an invasive method, and the non-needle techniques. Non-needle techniques, we call it non-invasive techniques. The two non-needle acupuncture methods, including box-beating, cupping, and acupress, do not require penetration of the skin and can be self-treated. I take some examples for the past 10 years studies. The first topic is the effect on serotonin and MDA levels. MDA means the free radicals final products. MDA levels in depressed patients with insomnia when far infrared rays is applied to the acupoints. This topic we have published in the American Journal of Chinese Medicine. It is SCI papers. First, introduction materials and methods. A total of 70 depressed patients with insomnia were recruited in the experiment. 2. 35 patients in the experimental groups receiving FIR treatment onto the acupuncture point, like 内冠 PC6, PC6, 生闷 HT7, and 三阴教 SP6. These 3 acupoints is a Chinese medicine meridian point, acupoint. And the third, 35 in patients without FIR treatment. 4. All subjects were provided informed consent. So we do something like a blood test. We use a serum biochemical assays. Serotonin. We detect one neurotransmitters, serotonin. Serotonin is an enzyme competitive assays are done using the specific ELISA kit for human serum. So we use a serotonin test kit and catalog RE59121. We also detect the final products of free radical. monodialdehyde, in brief MDA. MDA was assayed using a spectrophotometer methods. Okay, were done using a specific ELISA kit for humans as described in the many manufacturer's manuals. The result is we can see the experimental serotonin. They have more serotonins than in the control group. This is for serotonin part. As in the MDA part, we can see the experimental group. His MDA labels is lower than the control group. It means if we use FIR in our acupoints, we can see the people increase serotonin levels and decrease MDA level. So next, I introduce Western medicine's adverse effect. The clinical use of many antidepressants, including the serotonin-specific reuptake inhibitors, SSRIs, aims to restore the insufficient sympathetic 5-HT to previous level. However, adverse effects induced by SSRI may occur concurrently, including headache, nausea, dry mouth, and stomach upset. So, the present studies indicate that the introduction of FIR treatment onto the acupuncture point may lead to an adjustment of certain levels of serotonin and MDA in depressed patients with insomnia. This is the first paper I want to introduce for you. Maybe you can something problem to ask for this studies. Do you have any problems for this study? OK， 虽然屏幕讲完哈 ，OK， 好 ，OK，OK，Yes， 好，
所以要换下一个还是
？OK，Yes。So we continue is the two studies for our innovation of nursing study is the topic, the effects of lavender aromatherapies on autonomic nervous system in middle life women with insomnia. The insomnia problems is very serious as in the world war. Maybe if you insomnia as a long time, maybe you can get some CV disease or cancer, something like this one. So we have to pay attention to the insomnia non-invasive studies. These studies we combine with Taipei Medical University Hospital and my school, UNHS, NTU AUNHS. The design of the experiment is 67 female volunteers with primary insomnia were recruited with CPSQI interventions, bigger name 5 points. and then we randomize allocations to two groups. One group is 34 assigned to the aroma therapies twice a week for 22 for 12 for 12 weeks. Another group is 33 assigned to the control group without aromatherapy. We perform HRV measures. The HRV is an instrument. We call it HRV instrument. HRV instrument can measure sympathetic nervous and parasympathetic nervous. So we use HRV instrument measures before and after 20 minutes of aromatherapy at 4th and 12th weeks. We can and also the same time we perform the questionnaire CPSQI 3 months. Okay. This is our HRV instrument. Okay. So before test we have to rest 15 minutes, and we use the patch to the acupoints, and about something like 3 minutes, we can get the data. The data shows LF and HF. The LF means sympathetic nervous system activities. The HF means parasympathetic sympathetic activations. Okay, this is our demography table 1. And we can see after our aromatherapy, lavender oil to use to the inspirations, we can see the more autonomic sympathetic. We can see the decrease sympathetic nervous system and the increase parasympathetic nervous syndrome. Okay. This is our law of heart rate variabilities. We improve HRV in sleep disorders studies. Because we something like work pressures, and the work pressures to induce autonomic ANS syndrome disorders. Okay, so we can use the HRV to detect it. Okay, and we can see many auricular acupressure test. So I just to jump to the auricular acupressures PPT， 可以换那个发了，对。这个好学。
去那边跑，不好意思。
法律的。
另外一个吗？
对，法律 TCM。
好，等我谢谢。这个。
对，法律的。OK， 好。This is another innovation of nursing study. First, introduction of auricular acupressure. This is a non-invasive method fit our nursing research and can easy to publish in the SCI papers. First, introduction auricular acupressures. Auricular acupressures means ear acupuncture. But the ear acupuncture, the medical doctors use a needle to stimulate our acupoint on our ear. But the auricular acupressure is a non-invasive method to stimulate our acupoints under our ear. So auricular acupressure is a non-invasive, easy to performance, and it is a reflexology series. Therefore, usage of the location, function, and the indications of the standard auricular point to treat the clinical disease. This is our ear acupuncture. This is because our ear is like an inverted fetus map. You can see the fetus inverted. So your the button of our the ear is our eye point. Eye point this point, okay. This point is the eye point, okay. So we can use the ear acupoint to perform our auricular acupressure studies. This is our total point in our ear. We can see the renal, liver, spleen, endocrine. The renal point, if you attach the bean of we call it 王不留行 bean, 王不留行豆. We can attach the renal point to study something like reproductive and systems issues. If you attach the ear acupuncture to the endocrine point, and you maybe you can use a liver point to study our insomnia and endocrine something issues. The same we also use the spleen acupoint to study the parasympathetic problems. Before we use auricular acupressure, first I teach you something tongue diagnosis. In Chinese we call it 舌诊, but in English it's a tongue diagnosis. So first if you attach the ear bean to our ear, first we can we have to see the tongue. If your tongue is red, mouth is yellow, because you are in deficiency. In Western medicine, we call it sympathetic nervous system activate. If you mostly 刮痧, we will do it 刮痧, like this one, we call it insufficiency. This is a bladder meridian in Chinese medicine. We can see the some most, we call it insufficiency. So we touch 这个是碰的，镭射碰的对，没有，我们这个电脑就可以。If you sorry, If your tongue is red, mouth is yellow, because you are in deficiency syndrome. We use auricular acupressure point is a Senman point. This is a Senman point. The 2 point is a liver point. This is a liver point. And we use the 3rd point. This is heart point. And the 4th point is this is eye point. Okay, so we use the Senman point, liver point, heart point, and the eye point. We can relieve, we can decrease our sympathetic nervous system, SAS syndrome. Okay, it means decrease inflammatory disease. So this is this is 2 study. The second study, if you can see your tongue is something defect, okay, like something defective, we call it a spleen and the renal deficiency. If the women in the postmenopause, during the postmenopause, her tongue may be something like this one. So we call it a spleen and the renal deficiency. So we so our auricular acupressure studies, we use a spleen point. Previous studies, this is liver, right? Liver. This is Senman. This is eye point. In these studies, we use spleen point in this site, spleen point and the renal point. The renal point is under the Senman point. This is the Senman point. This is the renal point. And the 3rd point, you use endocrine point. So if you if your tongue is something like this, the tongue is something defect, we call the spleen and the renal deficiency. So we use a spleen point, renal point, endocrine point. Okay, maybe you can take picture. Okay. Okay. The 3rd topic is interesting topic is obesity and overweight. If you decrease your if you want to change your obesity and overweight syndrome, maybe you can attach this point, mouth acupoint. This point is a mouth point. If you attach this point, maybe you can decrease food intake. Okay. If you can decrease your food intake, maybe you can decrease your weight. Okay. So this is a mouth acupoint. And we use a spleen point. Okay. So I rehearse it. If you obesity or overweight, you can attach mouse point, spleen point. Okay. This is our auricular pressure studies about our acupoint in our auricular acupressure studies. So we 要回去刚才那一节。 对的，要小心。对，
放回去这个吗？
对。So we back to the SCI paper studies. This paper we published in the menopause SCI paper. This is a high quality SCI papers. Okay. The topic is the relationship of subjective qualities and cardiac autonomic nervous systems in postmenopausal women with insomnia under auricular acupressure. Before we introduce some auricular acupressure point. Okay, so this paper we use this acupoint to complete with our studies. 不能下一张，宕机。你是用这个宕机。
它是真的可以。
Yes. So I introduced the relationship of subjective sleep qualities and cardiac autonomic nervous system in postmenopause women with insomnia under auricular acupuncture. This is our acupoint beans. We attach something like this semen, kidney, heart, and brainstem and subcortex. 又回来这里。所以这个 PPT
这个吗？就这个。
Applying modern 对。
你是在哪一张？
我再往上，往下，对不起，往下。这张。好，谢谢。哎，怎么回来这里？往下跳。好的 ，OK。Maybe you can take photos with this acupoint in our ear, semen, kidney, brainstem, heart, and subcortex. This is our study results. The table 1 shows auricular acupressure leads to more cardiac parasympathetic and less cardiac sympathetic activities, which contribute to the improvement of sleep qualities. This is our the past SCI studies. In the 28 SCI paper, we used the biology method. That is, we say the innovation of nursing studies. The 28 SCI paper we published in the journal Alternative and Complementary Medicine. This is Q2, maybe Q2 SCI papers. Our topic is effects of auricular palate acupress on anti-oxidative systems in high-risk diabetes mellitus. And in 28, our topic we use innovation of nursing method. Published in the American Journal of Chinese Medicine. The topic is the effects of 八段锦 exercise. The 八段锦 exercise is a Chinese Kung Fu Chinese Kung Fu. Okay, so we use Chinese Kung Fu 八段筋 exercise on our oxidative stress and the anti-oxidation status and improving quality of life along middle-aged women. Because I am in the nursing department in the NTUNHS, so my topic is focus in the women. The women including postmenopause, young, and something disease with women. Okay. And the next year, 29, we also use auricular acupressures. So the topic is this paper we published in the journal Alternative and Complementary Medicine. Okay, the topic is effects of auricular acupressures on menstrual syndromes and nitric oxide (NO). Nitric oxide in brief NO. NO is a good free radical. The most free radical is damage to our body, but the NO, nitrous oxide, it is also a free radical. It is benefit to our body. So we measure NO, use ELISA reader for women with primary dysmenorrhea. Okay, maybe we can cooperate to international cooperated to do some experiment and common published in the SCI paper, mediated by the 你们的单位是TIHTC. Okay, maybe we can cooperation. Okay, the 29 we use another innovation nursing method, far infrared. We use a far infrared to some acupoint to do some experiments. So this study we published in the American Journal of Chinese Medicine. The topic is effects of far infrared acupoint stimulations on autonomic activities and quality of life in hemodialysis patients. As we know, hemodialysis patients maybe die. His death reason major in the CV problems. So we use far infrared acupoint stimulation to measure the hemodialysis patients' autonomic activities. Okay. The 29, the third paper is we use thermotherapy. Also in the UNIMUS pluralities and the biochemical parameters in patients having hemodialysis. This topic we published in the Journal of Advanced Nursing. Okay, Journal of Advanced Nursing and nursing research. It is both are good quality nursing study papers. Okay. The fourth papers we published in the American Journal of Chinese. The topic is the effects of serotonin and MDA levels in depressed patients with insomnia. Okay, when far infrared rays are applied to acupoints. So our studies we use non-invasive instrument like FIR, like auricular acupressures to our acupoints in our bodies or acupoints in our ear. Okay. In the 2010, SCI, we published in the American Journal of Chinese Medicine. This is a Q2 paper. The topic is electrical acupuncture stimulation. We use electrical instrument to stimulate acupuncture, change body composition, and meridian systems in postmenopausal women with obesity. Okay, this is a very interesting topic. Okay, maybe in women with obesity. Okay, the two papers we published in the Journal of Asthma. We also use transcutaneous electric nerve to stimulate acupuncture on children with asthma. So the topic is the effects of acupuncture-like transcutaneous electrical nerve stimulation on children with asthma. Okay. Journal of Asthma, it is a very rapid paper. If you send it maybe 1 week, you can get a result to reject or accept. Okay. So we continued our innovation nursing studies to 2011. 2011 studies, we use thermotherapy on insomnia with elderly patients. Okay, as before, I renounce insomnia. It can happen in the elderly, postmenopause women and middle-aged women. Okay, so we use the thermotherapy on insomnia with elderly patients. The result we published in the Journal of Alternative and Complementary Medicine. The tool is we use thermal therapies on major symptoms and the bone marrow densities. Okay. As we know, the menopause women maybe decrease bone minerals. So we use thermal therapies on some acupoints to increase menopause women's bone density. Okay. The third 2011 papers is published in the Journal of Alternative Complementary Medicines. The topic is the effects of non-invasive electroacupuncture at the HER2 L14, HER2 and the Sanyin-Jiao SP6 acupoints on dysmenorrhea. It is RCT studies. Okay. From this paper, from the old papers, you can find some pointers. We use a non-invasive method in acupoints in body or acupoint in our ear. Okay. So this topic is published in the JCAM. We in brief the Journal of Alternative and Complementary Medicine. We in brief call it JCAM. Okay. The full essay paper we published in the evidence-based complementary and alternative medicine. Maybe you have some problems because we are nursing. We can publish in this alternative medicine. The answer is right because we use a non-invasive method to find something results for humans' health. So maybe you can do this one study. Okay. So we use a transcuter. The full 2011 paper is a transcutaneous electrical stimulations. This is transcutaneous electrical stimulation is a middle frequency stimulation. Stimulations of acupoints change body composition and heart rate HRV in postmenopausal women with obesity. Okay. So the 2011 paper we published in the American Journal of Chinese Medicine. The topic is the thermal therapy. The thermal therapy not include the FIR. It's just only thermal therapy. Maybe you can use thermal padding, thermal water. Okay. So we use something this technique to do the topic thermal therapy in dialysis patients. Okay, it is RCT studies. So we jump to the 2012 SCI. Maybe we the first paper we do the analgesic effects of thermotherapy after total knee arthroparesis. So we use thermal padding to attach TKA patients' acupoints to see the neurotransmitter, serotonin, and MDA. Okay, we publish in the JCAM. Okay, the two papers in 2012. The topic is the effects of lavender aromatherapy on autonomic nervous system in middle life. Okay, middle life women with insomnia. We published in the paper we call it ECAM. Okay. The third paper is we do something maybe in Indians Kung Fu yoga. Okay, Chinese Kung Fu is 八段锦. The yoga maybe belong to the Indian Kung Fu yoga. So we use effect of yoga on serum homocysteine. Homocysteine is a CV disease marker. Okay, and we detect serum homocysteine and NO. NO is good free radical levels in adolescent women with and without dysmenorrhea. Okay, the result is published in the JCAM. Okay. Okay, and something in this year, we do something like AI papers in our Chinese medicines and something Chinese syndromes in recent year. Okay, when we have results published in the FCI, maybe we can share with you. Today, okay, so today is my topic for you. Yeah. Maybe we can discuss later, okay?
用示范。
哦，可以，来，拿一下那个贴纸。
So a quick break. The professor is going to show the ear acupuncture point.
So, for all participants, right now we come to the discussion session. For all of you, if you not yet, oh yeah, yes, already.
这贴下去就可以了。
Oh, auricular blood pressure demonstration about auricular pressure. Okay. Thank you. Okay, here you are, Professor.
头发再往上，这边这边再可以啊，转过来，能看得到吗？他们
等一下把镜头拿近一点。
Okay, yes. Our ear divided into two heads. This is inner heads. This is external heads. This is a liver point. If you do something experiments related to the metabolic syndrome, endocrine syndrome, or something like a sleep disorder topic, you can attach this liver point. The liver point is located in the inner helix. This point, okay, liver. This is one 不流行豆, one 不流行病. One 不流行 is a Chinese medicine like this one. Okay. The 2 point is under the liver point. We call it spring point. Maybe it's something like, okay, this is a liver point. Spring. This is a liver. Under the liver point is a spring point. If you do something topic about obesity, overweight, constipations, and the metabolic syndrome, maybe you can, or something cancer studies, you can use a spring point. Okay. And under the spring point is endocrine point. If your endocrine is if your liver, spleen, endocrine, something problems, the attach it maybe some pain. Okay, so you can see her eyes closed. she feel pain.
Yeah.
Yes. Okay. Yeah. This is a liver, spleen, endocrine. Okay. The fourth point is a renal point. Renal point is under the second point. So, 掉，对不起。
好像没有。
This 4 point is renal point. Okay, so liver, spleen, endocrine, renal point. The 4 points we called it health promotion points. So it's something you can do something experimental like fatigue, something this problem. Okay, or COVID-19 immunity topic. Maybe you can use this 4 point. Okay. The very important side acupoint for us is decrease our body weight acupoints. This is a mouse point. Okay, mouse point. It can decrease your food intake. Okay, this is a mouse point. Yeah. And the bottom side, our ear is our I point. This is I. Okay. So you do something. I issue papers. Maybe you can attach this point. Yeah. So from top to bottom is the final acupoint is Senmen. Senmen is above to the renal point. Okay. Senmen. This is Senmen. Senmen anti-inflammatory. It means if you can anti-inflammatory response, you can increase your immunity. So COVID-19, we attach Senmen, liver, spleen. Okay. So this is Senmen point, renal point, liver point, spleen point, endocrine point. This is a mouse point, mouse eye point. Okay. This is our demonstrations. 再指一次 Semen point, liver point, semen point, renal point, liver, spleen, endocrine, eye, mouse point. Okay.
要进入讨论。
对。So this is our demonstration. Thank you.
We can start the discussion.
Okay, thank you very much, Professor
我听
Chi-Feng
不
Liu.
到，
For
听不到了。
all of participants can see the demonstration of auricular acupressure tadi ya. So right now, time for discussion. All of participants who have joined in this room, you can raise your hand. The participant in the Zoom meeting and also can raise hand to directly ask to the Professor Chi-Feng Liu.
有看到他们已经有很多问题在聊天室。
还是一起开始了。
主持人会点。
And in the chat room, we already have 3 participants, 3 questions. I would like to.
我的耳机借一借，
我那边有耳机。
那就翻译过来就好。
Okay, Professor, the first question is come from Hendra. Thank you, Professor. It's very nice to be able to listen to your material in this morning. Introduce me. My name is Hendra, a Master of Nursing student. I want to ask a question as well as, you know that complementary therapy is safer than pharmacological therapy. And also, as far as you are doing research on this therapy, are there serious complications for the patient or respondent that have including in your research?
比较另类医疗比药物。
That's the first question.
但是
Professor Chi-Feng Liu, you want to answer one by one, or we collect?
Can we do one by one?
One by one, okay.
第一个问题是说，他们觉得 complementary therapy 有没有比较严重的并发症？
比较没有。
比较没有。
对。We use alternative complementary therapies, and their adverse effect is less than the pharmacological therapies. My major before is pharmacology, but I transfer my life career into the Chinese medicine doctor. So I something do complementary therapies. Okay. I also a naturopathic physician in America. But in American, we also use a naturopathic method to treat patients, something like COVID-19. Okay, we can see the adverse effect less than the pharmacological therapies. Okay.
Next question, please.
Okay, next. Okay.
Okay, for the first question, I think Professor already answered the question, yeah. The pharmacology therapy, the complementary therapy is safer than pharmacology therapy, and also as Professor Chi-Feng Liu say in the sharing discussion, the therapy that have been used by Professor is non-invasive therapy. Is it right, Professor? So the complication for the patient is minimized. So come to the second question from Miss Horia. Miss Horia. I would like to say thank you, Professor. I'm interested in the topic of auricular acupressure. So it can be used in patients with physical weakness, such as patient with stroke patient with neurological problem who have the problem with the motoric. So which area that we need to do for the auricular acupressure? That's the second question.
中风病人。
对，中风的。
Professor?
I emphasize our auricular acupressure is a non-invasive method to treat patients' disease or syndrome. But in Taiwan, we use auricular acupressure method. We have to apply IRB in the hospital. The IRB approval name we can do something experience in the hospitals, like HT patients, like stroke patients. I do experiments before. We use FIR on acupoints to treat HT patients. We can see some effects. It can decrease HT. Stroke patients, we also can use auricular acupressures, and but we have to apply the IRB approvals in the hospital to performance. I think if you attach the auricular acupressure point is the lever point and the segment point and lever and the spring point, because the spring point is mediated by parasympathetic nervous. If you can increase the parasympathetic nervous activities, maybe you can decrease the hypertension or stroke patients some syndromes. Okay. We are because you are a nursing department. Maybe you can use the non-invasive method, like auricular acupressures, FIR on some acupoints. Okay. But this studies this year we changed it AI studies. We collected for 1,000 data to machine learning. So if the data is showed, I will report. Okay.
Next question.
Next. Okay.
Okay, thank you, Professor. So the second question about the stroke patient who have problem with the physical weakness, we can use the auricular acupressure, right, Professor? Like you say, if you use in the hospital, it maybe need some legislation. But as you know, the stroke patient is when discharged from the hospital, it still have a problem with the weakness of the muscularity. So we can use that auricular acupressure, yeah. Miss Horia, actually very interesting. Maybe the next time can contact Professor Professor Chi-Feng Liu to maybe join research or something else. Isn't that right, Miss Horia? Yeah. Okay.
Yes, I am Miss Nuri.
Okay.
I
Continue. Enough, Miss Horia? Okay.
enough, Mrs. Nuri.
Yeah. Okay, thank you. And then we go to the third question. Yeah. It comes from Miss Mahmuda. Yeah. It's about the breastfeeding. Yeah. So is there a special acupressure therapy to deal with the problem in breastfeeding mother? For example, swollen breast or breast milk does not come or a little less milk. Okay, clear, Professor? Your time.
We are two methods. One is use our body acupuncture. We call it a Sao Zhe. This is our body acupuncture, Sao Zhe point. Sao Zhe point. We can stimulate. Stimulate. This is our body acupuncture. If you use auricular acupressures, we can use liver point, spring point, and endocrine point. It can increase breast milk.
Okay, so for the auricular, we can use the liver point and also the endocrine point, but also we can use the body acupoint in what do you call in this
Southern point.
point. Okay, okay. Is that clear, Miss Horia? I think the answer from Miss Mahmuda. I'm sorry. Yeah, the answer from Professor Chi-Feng Liu.
Okay, clear, Miss Nuri. Thank you, Mrs. Nuri.
Okay, you're
Thank
welcome. For the participant in this room who have, yeah, okay. Question directly to Professor. Yeah, you are.
Oke. Oke. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
My name Tegar Iman Amali, diploma nursing study. Let me ask you question. How effective is auricular acupressure for CKD patient? Thank you.
The auricular acupressure for CKD chronic kidney disease.
他是 master 的，他是硕士班。
Yeah, from acupressure for chronic kidney disease.
Chronic
Okay. Kidney disease.
Chronic kidney
disease.
他是要公司。
慢性肾脏。
renal.
Renal disease. Maybe chronic renal disease is something like to dialysis patients. Their syndromes. They show something similar symptoms. Okay, between chronic renal disease and dialysis patients. So I can do chronic renal disease patient, but I do a little dialysis patients. Okay. 它是个公司menu 对 ，OK。Maybe you can go to the Ovid or PubMed system to look some topics or my name Chi-Feng Liu. You can find some people in the Ovid and the PubMed system. Okay.
Thank you, Professor. And we still have one more question from in this room from Reza. Thank you for the great pleasure and welcome to UNIMUS. Professor Chi-Feng Liu, my name is Reza, Master of Nursing Student. I have read some of your scientific journal. I would like to ask you, which one is the best method between electroacupuncture or manual acupuncture for therapy?
他是问这个。
这个要看maybe you can find in the Ovid or PubMed website. The paper will show it. Okay, very detailed.
Okay.
Or we can cooperations studies by way of the
TIHTC.
yes.
You can ask us, and then we will introduce the professors to you, and then you maybe can work on the papers together.
Okay, thank you. Because for each therapy, so I have the each procedure and also the anything else. So we can study from the research that they have done acupuncture with the electro or with the manual therapy.
May I ask a question, Bu Nuri?
Oh, okay. Yes, you're welcome, Mr. Arik.
Hello, Professor Chi-Feng Liu. Actually, I'm your student of doctoral nursing program in Behu, but right now I'm studying.
Oh,
yeah, I'm actually who contacted the ISTC to contact you.
So who is professor?
My professor is Wang Caizhi.
Wang Caizhi. Oh, okay.
对
He is my good friend. Okay.
Yeah, and actually right now I'm conducting my study in Indonesia, so I'm coming back to Indonesia and also working in the university that inviting you for this activity. But I'm really interested with your study because I'm not really how to say it, studying the complementary therapy in nursing, but I really appreciate for your coming and interest for your topic, especially for acupressure, auricular acupressure. But my emphasis is there any limitation for age to conducting the auricular acupressure? For example, or it's not suitable for the infant or kids, something like that. Or what is the limitation of age? It should be adult or like child upper of
Yeah,
the 10
yeah.
years old
There
or
are
something like that.
limitations on chest. On chest.
On
We
child.
use auricular acupuncture. We use more than 3 years old chest.
Oh, 3 years old, more than
Three
3 years
years
old.
old to the mm, to the maybe 18,
Okay.
80, 80, 80, yes.
Okay. My next next question. I'm sorry. I prepared several questions. Continuing for the auricular pressure because you just demonstrate like the few minutes or few seconds. So actually, how long we can do the pressure to our ear so it can make effect like to
Okay.
the health problem that we
We
desire.
will attach a point 5 days.
5 days.
5 days.
And
And
and how
5 days,
many?
and before 5 days, we remove it and take rest 2 days. And the next
Oh,
we attach 5 days and remove it, and then we rest 2 days. We perform these studies. We have to 3 months.
oh, that is quite long, right?
Yeah, yeah. Because in alternative medicines SCI paper, they have a rule. We have to do like something these studies maybe 3 months.
Oh, longitudinal studies like
It's a rule, yes.
and
It's a rule related to the alternative medicine studies.
yeah, and I'm curious what kind of the stickers that you put on the ear.
Yeah,
What is
yeah,
that?
yes.
Is that a
Yeah.
thermal?
This is because of attached the ear is produce pressures. The
Oh,
pressures can increase blood flow in our body.
you develop it by yourself, the stickers?
Uh, this is a 3N attachment, 3N attachment, and this is 汪不溜心病.
Oh,
汪不
3M.
溜心 is Chinese medicine.
Oh, yeah, I see, I see. Yeah,
Yeah.
because I just curious when maybe next time that if we would like to conduct like
Yeah, maybe you can accomplish your PhD program. Maybe you can overseas collaboration.
All right,
Okay.
all right. Thank you so much.
Very
That's
interesting. Huh?
yeah,
Yeah.
that's very interesting.
Yeah.
Thank you so much, Professor Liu.
Thank you. Thank you. I will tell you, Professor Wang Caizhi. Okay.
Yeah, yeah, sure.
Very good student. Huh?
Okay. Okay. Thank you very much, Professor. And we still have time.
CPD is fake.
There is one more question in the chat room. For conduct the auricular acupressure, so we only do the practice, or we need some certification for conduct the auricular acupressure to the patient. That's the question from our student.
好像他是问说，要
In bahasa from Sahyani
去的话，是不是要有证照？
不用。In Taiwan, this is a non-invasive method. Because our nursing have nursing 证照 certificate, the nursing certifications is very fit to do something like this studies in hospital or in our community.
So actually, because the auricular acupressure is non-invasive, so it can be used in the hospital also. But for the person who conduct the acupressure, is there is some special license for that person to do that, Professor, in the Taiwan? In Indonesia, such as we need some registration from blood, to they have already expert in the auricular acupressure, something like that.
他说在台湾这样。
对，他们在台湾有没有？
Yes. License. Yeah.
Oh, maybe we have to 反正两本课本拿来，一个中药，中医中药的。In our school, we have teach some basic course. This is Chinese medicine theory. This is all Chinese medicine, and in Chinese medicine basic theory, we teach it. So we have to training maybe one semester, and you can perform this auricular acupressures or acupoint in our body's experiment. Certainly, you have to discuss with me, okay, or something professors familiar with this area.
Okay, thank you, Professor.
So in our nursing department or our PhD or master course, we have 4 Chinese medicines course. The one is diagnosis of Chinese medical science. 2 is chem in nursing therapy. The third is nutrition food. The 4 is basic Chinese medicine. Okay. Recent year. Okay.
Yeah. Okay, Professor. I think for all of us who have still interesting about the auricular acupressure and want to study more about that, we can contact from the TIHTC, who have already conduct a lot of
Yes, yes.
Yeah, is it right, Krista? So maybe some of us can go to Taiwan and then to study about the traditional Chinese medicine directly with the Professor Chi-Feng Liu. I
就
think.
他可以安排来这边来
Yeah,
那边
yeah.
受
We
训，
can
然后我们
send an
从头
an
教，
email.
对，
Yeah,
也可以来这里实地学。
yeah.
嗯嗯
这样
Okay. I think. Is there any still have one more question from the audience in this room?
好像这一场就是有
One more question, Professor, from the
对对对，
student who have attended in this room.
荧幕上看起来
Okay,
蛮
you are.
蛮英俊的。
Okay, Professor, let me introduce myself. My name is Egi Dia. I'm for Diploma of Nursing. Let me ask you some question. On the ear acupressure point slide, there is a lot of anatomy. Does ear piercing affect the organs piercing by the needle? Thank you.
Needle. No, auricular acupressure is a non-needle treatment.
No.
If you needle
Uh,
is
no. It's the piercing on ear. Yes, earrings.
earring. Earring maybe some effect, a little, because the 1不6性 is Chinese medicine, something drug effect. Okay, the effect I think more than just a ring, earring. Okay. Yeah,
Auricular acupressure in the ear.
yes. But earring effect is less than 1不6性. No, okay.
Less effect. Yeah. So for the conduct the auricular acupressure, the earring must be
可以跟他讲，我在学校有教一些创新的课程，创新的课程就是把耳朵改良，然后让他们挂在耳朵。这种课就是创新设计。
So our professor said that he is teaching some innovative lessons in the school, and one of them is to transfer the sticker into something like earrings.
Oh yeah. So we can like use some
Earring.
Actually, we use
Beautiful
we use the
earring.
thing. Okay. Thank you thank you so much, Professor. I think that's all the question from all our participants. Let me see in our chat room.
Okay.
Oh.
Thank you, everyone. Welcome.
Enough, I think. And
还没，
we
我要结束。
finish for our agenda today. I would like to read some summary from our professor lecture from today. That traditional Chinese medicine is actually is a medical care, yeah, not a alternative of the medicine, but it can use as a medical care. And there are Professor Chi-Feng Liu already shared about us about the research that have been done that use meridian and acupuncture such as acupoint, yoga, panduan jian exercise, infrared acupoint, thermal therapy, and also aromatherapy that have been very good have effect in the health problem. And the traditional Chinese medicine and also more safety than the conventional medicine that have been some of the side effect. Yeah, I think that's all for today. I would like thank you very much to Professor Chi-Feng Liu for your share today. That all of us the participants already hear from your research. So I would like to say thank you very much for all the participants, and I'm so sorry if our speaking is not true enough because English is not our mother language, isn't right, Professor? So thank you very much. Assalamualaikum warahmatullahi wabarakatuh. I would like the agenda, the MC.
Okay, thank you, Ms. Nuri, for moderating the presentation and discussion session. Okay, the next agenda is awarding the certificate of appreciation. Let's give a round of applause and welcome Mr. Arik Franada as the representative of the nursing department of UNIMUS to award the certificate of appreciation to Professor Chi-Feng Liu.
Thank you very
Professor,
much, everyone. Okay.
yeah. Okay, give a big applause for the speaker and Mr. Arik. Okay, thank you, thank you, Professor Chi-Feng Liu and Mr. Arik. Okay, enough.
Thank you, everyone. Okay. Welcome to Taiwan.
Yeah.
After COVID-19.
Okay.
The COVID-19 in Taiwan is very safety, I think, because I use auricular acupressures, needle acupunctures, and something our Chinese medicine. Okay. So our Chinese medicine divided into folk medicine and herbal medicine. Maybe I think in your country you have something folk medicine. Yes, herbal medicine, folk medicine. So we can use our folk medicine combine our Chinese medicine to prevent COVID-19. Yeah, it's very effective, I think. Okay.
Okay, thank you, Professor Chi-Feng Liu. Okay, ladies and gentlemen, maybe we are going to take a group photo. Please. Yes.
Okay.
Please, for IT team, please take a photo virtually. Okay, open the camera for all of the participants.
谁的模式？他的模式可以啊。可以啊，用他的模式，用他的模式好。可以，这样怎么弄？这样就可以了。
Okay, please remind the seat. Open the camera, strike a head and smile at the camera. 1, 2, 3. Okay, next. Please open the camera for all of the participants.
He is my graduate student. His topic is something like AI in Chinese medical science. Yeah, maybe we can discuss later. Okay.
Okay, 1, 2, 3, finish. Next. Okay, please open the camera. Okay, finish. Finish all of the participants. IT team, okay? Okay, finish. Okay, thank you very much for your kind cooperation. For the speaker, Professor Chi-Feng Liu and TIHTC team, and also for all the participants. On behalf of the committee, we would like to thank the speakers and the audience for their active participation. Hopefully, the presentation will give benefit for us. Keep safe and healthy. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
可以关掉。这样，他们问。
他是问说可不可以把今天课程的那个简报
PPT
传给他们？
传给他们，这有一点专利耶，
哦，
因为耳豆有点专利。Yes， 但是可以利用 email 讨论，他可以写 email。
So the professor said that the slides contain some of the information that's not okay to be public, but maybe you write email to the professor to
email,
discuss.
okay.
那可以请。还是说，
可以，我可以删些东西，然后 email 给你。
Okay. So the professor will remove some of the slides and then send it to PIHTC, and then I will show it to you.
Okay. Thank you. 结束。好。So thank you everyone. Okay. Again, welcome to Taiwan.
Terima kasih Pak Ari. Terima kasih Bu Dewi, Bu Nuri.
Thank you Dede Dewi dan Dek Ari, Bu Nuri.
Iya Bu Yuni, sama-sama Bu Yuni. Terima kasih adik-adik yang sudah hadir di sini.
Recording stopped.
Berpartisipasi dalam kegiatan visiting profesor hari ini.
Saya mau fotoin Mbak Dewi dulu, madep sini Mbak. Ini screen-nya bagus kok. Sebentar Mbak Nuri, sebentar Mbak. Lihat sini Mbak. Sis, 1, 2, 3. Sis. Nah, cantik. Anunya bunganya cantik. MMT-nya cantik. Terima kasih ya Mas Arik. MMT-nya bagus, sudah pinter. Oke. Terima kasih mahasiswa yang sudah hadir juga. Alhamdulillah hari ini pesertanya banyak Mas Erik. Yang kami hormati izin live ya Mas.
Iya Mas Arik, baik Bapak Ibu dan seluruh peserta visiting profesor hari ini, sekian untuk acara visiting profesor yang sudah dilaksanakan oleh program studi keperawatan UNIMUS. Mudah-mudahan materi yang kita dapat hari ini bisa bermanfaat kita semua. Amin. Terima kasih atas kehadirannya secara virtual, baik secara online di ruang 408. Ya, baik. Ini kami akhiri meeting hari ini. Sekian, terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.